Sure. So atrasentan is a classic endothelin receptor antagonist. So it blocks the endothelin 1 receptor. So it can block downstream all of those specific effects that endothelin has on its targets. So the ALIGN study was really designed to be an authoritative test of the role of endothelin blockade with atrasentan in IgA nephropathy. So blocking endothelin was purported to have multiple benefits because it acts both hemodynamically to reduce glomerular pressure, reduce proteinuria, but it also has multiple effects on other cell types, including immune cells, resident kidney endothelial cells, mesangial cells, and podocytes. So it can be both hemodynamically stabilizing, anti-inflammatory, and stabilizing to innate kidney cells. So it's really exciting to take this study forward. This was a randomized controlled trial of adult patients with IgA nephropathy who still had more than a gram a day of proteinuria, GFR over 30, and were on maximally tolerated RAS inhibition and compared to placebo. And the primary goal of the study was to show at 9 months that proteinuria would be statistically reduced in a clinically significant way. And then with a 2-year outcome plan to show stabilization of kidney function compared to placebo. So in this Part A 9-month analysis, we have seen the data that there was indeed a statistically significant reduction of proteinuria in a way that should be quite clinically significant because the reduction in proteinuria was 38% and about 35% relative to the placebo group, and that it has been suggested by prior studies and meta-analysis to be clinically significant to predict a benefit to patients' long-term outcome. Correct. So again, the FDA gets to see all the data for the patients once that 9-month interim analysis is done on a large subset of the total population. But the 2-year data will explore, again, as a primary outcome, changes in kidney function by estimated GFR of the atrasentan group versus placebo. It'll fill in further gaps about any subgroups. It'll look at sustainability of proteinuria, and will also, very importantly, further comment on safety, because again, at the 9-month interval, we also saw a very nice safety record. Endothelin blockade in the past had been associated with some signals towards liver toxicity, towards volume retention, even bad enough to cause heart failure. But again, there were no signals towards liver toxicity in this study. There was only very, very mild and reversible signs of any fluid retention with no severe adverse events such as heart failure. So we'll be able to further evaluate both the efficacy, that proteinuria reduction, look at subgroups, look at GFR stability as the primary outcome, and further evaluate safety. So it'll be very exciting to see further data. Yeah, it's really a beautiful, very, very exciting addition because just as you were discussing, just a little over 2 years ago, we were really relying on RAS inhibitors to be our workforce for slowing progression of chronic kidney disease in IgA nephropathy patients. And the evidence was that even though they helped, they didn't do enough. Others relied on corticosteroids or systemic immunosuppression, which was associated with a substantial amount of adverse events and had a mixed record of efficacy. So moving forward, now having multiple agents that can target the galactose-deficient IgA production that underlies IgA nephropathy, further target potential antibodies against those galactose-deficient IgA, target the inflammation that might occur, such as using complement inhibitors, use dual endothelin antagonists together with angiotensin receptor antagonism. There's so many more options now that we really can tailor our therapy better to our patients. And a standalone endothelin antagonist like atrasentan is really, again, very, very exciting to have in our toolbox because patients who are doing well on their underlying therapy but not quite at goal, this is really a great opportunity to get them exactly where we want in the hopes of really keeping their kidney function stable over the long run. So it's just a very exciting, great addition.